I think the one anecdote that most of us that were there at the time remember clearly is that there were two lobbies. There was a lobby for the Children's Hospital, and these lobbies both faced Punahou Street. And there was a lobby for the Kapiolani Maternity Hospital. This was intended at the time to maintain the discretion of both of the unique clinical specialties, so people would not feel disenfranchised. Now, these lobbies, again, were right next door to each other, but yet they were separate. At the time of the merger, it was a merger of physical plant and back office administrative items. It was not a merger at the time of the medical staff bodies or the boards. That merger of a full coming together from a legal business board perspective and a medical staff perspective didn't actually occur until 1984. So it took 6 years. Now, why 6 years? At the time, mergers were not customary, as I mentioned a little earlier, in the healthcare field. And in order for people to feel comfortable, number one, living together, we have to feel comfortable having our OB nurses and our pediatric nurses living and learning together, as well as our medical staffs living and learning together, getting accustomed to this, our boards living and learning together to understand the uniqueness. It's very common that we all want to preserve and protect what we hold near and dear to us. And if you were from the Children's Hospital, your primary focus solely was on the care of children. If you were from the maternity hospital and you were an obstetrician or an OB nurse, your primary focus in your career and your passion was moms and the newborns. So it makes sense that when all of this is coming together, people had concerns about what will we lose clinically, what might we lose in what our resources have been. So it took 6 years for people to become comfortable, to learn that this was not a synergy that was going to take away resources, but a synergy that was going to create something so much stronger than each of these individual entities. And it did just that.